Hello and welcome back again. I'm Dr. Amin Gasmi from France, physiologist and micronutrition scientist. In this session, we will talk about the relationship between impaired barrier and autoimmunity. When tight junction loosen, we will have antigens and microbial fragments that will cross the barrier, the mucosa, and will make the immune system overreact. And we will have either autoimmunity or autoinflammation. So we have to repair the barrier with fibers, with also butyrate, which is a short chain fatty acid. Probiotics and postbiotics will be used also regarding the good phenotype, and also zinc carnosine, which is an amazing solution for all the digestive barrier. Also, vitamin D and selenium are very important. Hyperpermeability is not only in the intestine, but it is also located in the mouth. This is why it's important to treat dysbiosis and periodontal inflammation. So the main message is quite simple here. Seal the barrier, reduce all the toxic load, and the immune system will have a very few reason to overreact. Thank you very much for your time. I'm Dr. Amin Gasmi, and I look forward to continuing this discussion with you on micronutrition and functional medicine. Goodbye.